Hi there, beekeepers. Today, we have Nydia Narcisse with us today for our women's series. And as always, I'm Key and zooming in today from the ancestral lands of the Lumbee people in North Carolina. And we want to extend a warm welcome to Nydia Narcisse, who's going to talk to us about the benefits of having a doula as we bring new beings to the planet. So welcome, Nydia.
Thank you. I'm glad I could be here.
Yeah, I would love for you to share with us anything you want us to know about this exploration that people might be encountering, bringing children into this world that we love.
Absolutely. Okay, so I have I love doing this. Okay, so basically I can start with what is a doula. And a doula is basically a trained companion, keyword companion, because we're here to support the mother and the partner of the baby, or even the birthing person, not even just the mother, the birthing person and the partner, and provide them critical and continuous care, whether that be emotional, physical, psychological, and it's all individualized. It all depends on what this person and their partner is wanting. And we're here to provide that support in a very non-judgmental way, while still being able to take everything that they say in and be able to apply that throughout their whole process. So that may look like accompanying them to doctor visits. That could be just teaching them simple things such as breathing techniques and how to keep themselves calm in the time of birth, how to keep themselves calm during the time like through laboring. And we emphasize, I know me personally, I emphasize trying to make sure that it's good for baby and the birthing person, because a birth is not just about the birthing person. Though we may think that, because like, oh, this person has to give birth and has to push a baby out or like get cut open to have the baby come out, but it's also about what the baby may like. Because for instance, some babies may not like a water birth. The person may want a water birth so badly, but the baby may not agree with that. So we have to go with things that's good for the birthing person along with the baby. We also do a lot of helping them to educate them using like evidence-based things, giving handouts and stuff like that, so that way they can become educated on what's being given to them, what's being brought to them at doctor's appointment. Me personally, I feel like it's very important for the birthing person to know their rights. So that could look like me giving them a copy of birthing rights, maybe finding out the rights of the laws and rules of the hospitals and giving them that information, so that way they're understanding what's going on. Even having them bring questions to doctor's appointments, having them just be more educated on what it is that they want, finding out things like what a GBS swab test is, finding out, like the benefits of those things, how they give babies vitamin K shots upon birth, knowing that you can refuse this shot, but your pediatrician may not want to see your baby, after that. So little simple things like that, but that is really actually major and can make a difference in a baby's life, along with the birthing person. I even go as far as kind of helping the partner to know how to advocate for their birthing person. And it could be simple things as not even telling them how to speak to the professionals coming in, but even just stand up on a certain side of the bed, so that way they have to get through them to get to the birthing person, and just kind of advocating for them in ways for whenever they can. A lot of times things happen really fast during a birth, and so some things will get overlooked, or we may misconstrue words that were told to us. So for instance, they may say, hey, I'm about to do this till you do your mind. And the birthing person might say, no, I don't mind. And they take that as, oh, she's okay with it, or they're okay with it. When in actuality, the question was not asked, can I do this? So we teach them a lot about permission and how to, advocate for body autonomy, how to advocate for everything that they want and everything that they need to follow along with like their birthing plans. I'm big on helping make birthing plans, so that way we know if you can't speak in that moment because you're on medication and you're a little loopy, look, here's the birthing plan. This is something she wanted. This is something they wanted as a couple, as a unit, and this is what we want to respect. And I'm never there to overstep or to go against their words or to pick a side with anybody. I'm here to make sure that their rights are being met, their needs are being met, their wants are being met, and they're treated with respect and with the utmost, like they get to keep all of what they want, all their wishes are being respected. So that's my portion of it. That's how I like to look at it. I like to think of it as I'm being supportive, but it's also not just me like, oh, it's going to be okay, or helping them with breathing. That is a portion of it, but I'm not just here to help brush your hair and make sure you look good while you're birthing. I'm here to, you know, really help you in that birth where it counts, like helping you to remain, keep that breath and know how to breathe through these things, to learn these different movements on how to make that baby move down if they need to. So I'm aware of like some birthing positions they can get in, like how you can rotate from side to side, how you can birth on, you know, if you're on your knees, you can push your baby down a little bit. There's different ways and techniques of lots of things that can be done. So that way it's an easier process. I provide information for mothers that want inductions. If you want an induction, I know the multiple ways that inductions are given. I can give them the education on that. And again, I'm not imposing my beliefs or anything on them. I'm providing hard fact information on here's this, here's that, here's a one-page handout, here's this website you can check out, because I want them to be educated overall, because it's a very tricky thing. And so a lot is going on and you want to focus on, okay, is my baby safe? My baby safe? But there's also, is the mother or the birthing person safe at the same time? Because if that person isn't safe, then that directly affects the baby. So if, for instance, if mom isn't breathing properly, she's losing oxygen, so is that baby. If she's stressed out, that fetal heart rate can go up and cause more problems. If she starts to decline, that baby's fetal heart rate can decline. So there's a lot of things that go into it. So I like to make people understand that being a doula is not just the beautiful eyes and oohs and the, I'm here to help you and I'm here to do whatever you say. It's gonna be some hard labor sometimes. It's gonna be some nights where you're at somebody's house helping them try to get through labor as long as they can at home before, you know, going into a hospital because they're afraid of an epidural or they're afraid that they get it too early and it may not work. So I'm big on just making it as transparent as possible. Like here, like, hey, I'm here to help you through the good, the bad, the hurt, the ugly, the everything, because that's what birthing is. It's an experience overall. It's a beautiful experience. But it can get a little, you know, rocky along the way with just about anything. You know, it can be a bit rocky in the beginning. That's just part of the process. As you can see, I have a thing on the wall. It says trust your process. And I'm big on that. It's like, we can't, and I also tell that to my birthing people, don't compare your process to anybody else's. Even if you have multiple babies, your first pregnancy and your first birth may not be the same as the second or third or however many you may have. Babies are different. Different babies like different things. It's just like with a set of twins. You may have a calm twin and you may have a twin that cries more than the other. And that's, I mean, the births are going to be different. So I just try and get that point across to them and let them understand that it's your process, but you get to pick your own birth experience. You get to plan your own birth experience because it's about you and your baby. It's about stuff that y'all would feel comfortable with, what works for everybody. It's not what works for each person. One size doesn't fit all.
So much to think about and process. I'm so curious. How are there doulas in the hospitals? Is that something that comes through the hospital, or would someone need to seek out a doula?
So some different states have different allowances, I guess you would say. Like here in Louisiana is not a state that would have doulas readily available here where I am. But certain doctors, like if you go to a doctor, you can say, hey, I have a birth supporter with me, because not all doctors like the term doula, because doulas are not allowed to actually do the birth. We're not there to touch the baby or anything of that nature. We're here to literally provide support. That's what we're there for. So some doctors will, you go into, so I know for us here in Louisiana, we go into an appointment with a client and you ask them straight away, like, hey, they'll go to their first appointment alone, and they'll ask the doctor, can I have a birth supporter with me? Can my birth supporter be here? Some doctors say yes, some doctors may say no, or some doctors will even say, you know, if you have a doula, then I may discontinue services with you. Or if you have a doula, you can have that, but they can't come to the appointment with you. So it's just kind of based on different doctors. But I know there are some states, if I'm not mistaken, Atlanta might be a state where you can like have a doula, like they have the hospital doulas and those things. And then here we do have hospitals that allow us to go into the room because again, like I said, birth supporters. So it's like, you know, you're allowed a certain amount of people in the room with you during birth. So they're aware that, hey, she has a birth supporter, she has a partner here, she has whoever else here, and that's what we're there for. So in our state, no, the hospitals don't provide them. So you'd have to kind of go out and find your own. And so with that, we have like a network of some people that do doulas, that offer doula services. And then we have people, like if you Google them, you may be able to find some people. You type in like doulas in Louisiana. There is like a registry that you can go to and it'll have the doulas all listed. And based on your state is kind of basically how you find them.
So I wonder if you're willing, if you share the registry, it might be helpful for people to know, and either you can place it in the chat or email it to me and I will make sure that everyone has access to it.
I definitely can.
And I'm curious about how do, it sounds like doulas also are really skillful at, providing boundaries and giving agency to the birthing couple, right? The partnership. And I'm curious about interactions with nurses. How has that been for you working in a hospital?
It hasn't been bad because I kind of go in with I'm here to support the mom, the partner, the birthing person. I'm here for their support. I'm not here to overstep your job. You're not here to overstep mine. So we have that wonderful relationship of I'm going to stay in the place that I belong in and ask. And like I said, I don't speak for the birthing person. So I'll just kind of like give them a look, or I'll just, say, remember when you said that we were concerned about such and such, kind of just to bring it back to their memory so they can ask the question. So, and then if they don't ask the question, I'll ask them, hey, can I speak on your behalf? Or can I say this on your behalf? And then once I get that clear communication is when I'll step in and say something if I have to, or like I'll look at the partner and say, like give them a look or something, or even tell them, like, remember y'all discussed this and, we may want to ask that now at this moment, just so that way I'm respecting their autonomy and everything that they want without me overstepping the boundaries. So that way I don't put anyone in an uncomfortable position. As far as nurses, doctors, the people like my clients go, I never want to overstep. So I always make sure that I'm staying in my respective bubble and, making sure that they're still being heard.
So it sounds really empowering. So the experience sounds like it's this co-created sort of pathway for the baby, reducing stress and increasing communication.
Exactly. That's what I shoot for. Because I feel like with clear communication, it's less stress on the birthing person, less stress on the partner, and it's an overall better experience because it's clear what their wants, needs, and desires are to the nursing professionals and the healthcare professionals and the doctors, and it's clear to them that it's being understood and they're getting like a reciprocation of respect in the situation.
So interesting. So what drew you? I'm so curious. What made you want to be a doula?
So what drew me to being a doula is that I'm the second grandkid of 11. And so I think the age gap between me and the third is about 5 years. So I've always been present and around all of my little cousins upon birth and like seeing their moms pregnant and like cleaning wounds from cesarean sections and like just changing diapers and helping. And then also as I got older, I got more into like holistic lifestyle and also just finding out that African-American women have the highest death rate in birth and in children and in birth rates, like highest mortality rates in that. So it really drew me to wanting to be a doula to help that community and making sure they're being advocated for and heard. So we can decrease those rates because we don't want anyone to die, any mother or birthing person to die or a baby, in birth. So especially when I found out that my community was the highest rate, I'm like, okay, I may not be able to make the total change, but I can be a part of that change.
Yeah. Wow. It's a calling for sure. I had no idea about that. That is, yeah. And that's in hospitals too?
Yeah, it's definitely is in hospitals, is in and in home births, it decreased a lot because they noticed that, in a home birth setting, more times and often doulas are allowed, birth supporters are allowed. So people are being heard more. And it's less medication sometimes in home births. Don't get me wrong, they still have the medication that you would have in a hospital with the midwife. So you still can get that, but a lot of times you're being heard a little bit more, and it's a lot more of a, you can try a bit more in like a home birth. You can try and do different methods as opposed to at a hospital, you're confined to a bed. Like especially if you get a receiving epidural, a lot of times they tell you in the hospital, you can't move once you get an epidural. Mm-hmm. But in actuality, you can kind of move from left to right. So you can have some mobility, but just not full mobility as you would be able to if you did. So not all hospitals allow you to be able to, move around during your birthing stage and get into comfortable positions and things of that nature, because some hospitals don't even offer other things to help birth, like a birthing bar or like a ball or anything of this sort. So it's just like, it's more of like a confinement thing as opposed to just being able to kind of listen to what your body says. And like how we used to go back to old times whenever we allowed mothers to birth wherever they were comfortable. And so it just kind of, it became more of a systematic thing as opposed to just allowing the body to naturally flow.
Mm-hmm. Which I imagine is also easier on the baby when the mother has an opportunity, greater access to her own body, especially movement. When, absolutely, our body, I feel, naturally moves away from pain or moves through pain in the way that it feels comfortable, and being in a place where you're constrained must feel, I would imagine it increases anxiety in the birthing person, right?
Yep. And that's how a lot of moms may end up, in emergency cesarean sometimes. Now I'm no like healthcare professional in that sense, but I know with our, like just from our knowledge of being counselors, when you have anxiety, usually your heart rate goes up. So once the mom's heart rate is up, that fetal heart rate may go up, and it may send baby into distress. Once baby's in distress or anything like that, your pressure usually starts to go up once you're in a stressful situation for too long. And once your blood pressure goes up, that causes more problems because now baby is probably in distress, and that can lead to an emergency cesarean. All because, you may be stuck in a bed and you can't get as comfortable as you want. You're in pain and you can't really move too much.
Wow. So there's a lot to think about. I'm also really curious. I know when you earlier had mentioned how things can change quite rapidly. Is it also a part of what you're dealing with is the partner's anxiety, watching their beloved in pain? How does that get managed in that relational field?
So for me, when I'm doing like the deep breathing techniques or like the coping things that they want to use, I'll ask them, and we also check with the doctor, check with the hospital before we bring anything into a setting and it be not allowed. And I would hate for that to happen. So I always try to find out, with the doctor beforehand, like, hey, are you going to be at this hospital when this mother or this birthing person goes into labor? Okay, if you are they allowed this? Are they allowed that? Like I have a mom who wants music. Okay. Mm-hmm. We asked the doctor beforehand, is she allowed some type of music in this birthing room whenever she goes into labor? Is she allowed, some moms want aromatherapy. Is she allowed aromatherapy in this hospital because this is going to soothe her and her partner? And the result that they say no, then we try to find something else. And I like to make sure that the partner is at least present for half of our visits, so that way they are aware of things that they can do to help their anxiety as well as helping their partner. Because again, it is about both of them, but it's more about that birthing person because they're going through so much of, like, they're taking the everything in. And so them being calm can help with the birthing person being calm. So having all of these things like in the birthing plan helps with that. So I make sure that in the birthing plan, we have a portion for the partner as well. What can you do to keep yourself calm? What can you do to make sure that you're calm enough to be able to help mom? What can you do if you become too hyperextended and too, overwhelmed? What are things that we can do to bring yourself back to base so that way you are clear and level-headed to help advocate for your birthing partner and for your baby?
Okay. And you would be in the room. So if the anxiety is getting too high and perhaps a medication was suggested, that wasn't part of the plan, that there are some exercises or breathing that you could work with the couple to restore balance, it sounds like. Is that how it works?
Yes. So if there's a rapid change of some sort, if we have the time, I'll look at them and I'll say, you know, y'all need time to discuss this. And we can go as far as I'll even exit the room with the healthcare professional. So that way they know I'm not swaying a decision here. I'm not affecting any decision that's going on. I'm just here just as much as you are here just to help them get through this process. So it gives them some time to, you know, discuss. And then I'll come back in and say, okay, you know, have we reached a decision? Have you guys decided what you want to do? We may discuss it for a little bit and they say, hey, this is what it is. And that's it. If I have the information on hand, I'll give it to them. If we have enough time, I'll look up through my resources, see what I can provide that's educational, that's, you know, firm facts. So it's, again, not my opinions or my beliefs. It's solely based on facts and evidence. So that way it's never oh, what my birth supporter said, my doula said. It's evidence-based, it's backed up, it's fact, it's, you can pull from an actual hard resource that said the benefits or the risks of this and anything of the sort. So I definitely try to make sure that I do have resources readily available on hand. So that way, if they do have to make a decision, or if it is a spur of the moment thing, all I say is that we don't have time, for instance, to make a decision. I'll say, okay, this maybe wasn't part of the plan, but we have to do some fast thinking. What are your benefits of this? What are your risks of this? Is there an alternative to this? Like, what can we be doing in this fast thinking, so that way we know, okay, you made the best decision possible when you had little to no time.
Yeah, those quick decisions when a crisis might arise, like you had said, you know, anxiety, the blood pressure might go up or the babies might go up. And I'm curious about things like longer labors. You know, if they can labor at home, I would imagine they can get more food in their body, more hydration, right? Because when you get in the hospital, it's like ice chips, right?
Right. Yeah. And so that's what I try to stress to moms, you know, if you can labor at home for as long as you can handle it. If you feel you can't handle it for much longer, then you immediately go to a hospital. I just ask you contact me at least an hour before you decide to go to the hospital, so I can get to you at your home, and maybe we can work on those techniques and different positions and things, so that way your baby can start to move down, so that way you can, you know, labor comfortably, and like you say, get food, get hydration, because that all goes into your energy. And babies and delivering babies takes a lot of energy. So a lot of times, once you do get to the hospital, like you said, those ice chips, that doesn't do much. Like, it hydrates you, but it doesn't put nourishment back, so that way you can provide all of the energy that you need to get this baby out.
Mm-hmm. And what about things like a touch, like a therapeutic touch? Is that something that you incorporate, any type of massage? Or I know there are people that do pregnancy massage. I'm not sure about labor massage. So I'm curious about, you know, what type of muscular relaxing, because it does take a lot of energy in the muscles and in our bodies. I'm just curious.
It definitely does. So I am not particularly certified in like labor massages, but I will if I see that she has like, oh, my back is hurting, or I have a knot here, I have a knot there. I'll just, you know, rub it gently. I'll like rub downwards, or if that baby is high up in the belly, we'll just rub down towards your belly. But before touching, I always ask, is it okay for me to touch your body? Once I get permission, yes, it's clear communication. Okay, I'm gonna do this, and we may do that. If they're in a bed and have an epidural, she says, oh, my legs are hurting, I'm tired, being that they won't let them like get up and walk around after an epidural because it's not safe with the needle. I would like do leg massages. Like, let's partner, you take the other leg, I take one leg, we go back and forth. Like, we're moving those legs, we're getting her some mobility, being that she doesn't have all of her mobility she would normally have in being that they're confined to a bed. So I don't go as far as like deep tissue massaging or like deep massages. But I will like rub if you have an ache, or just like give you a simple, just a nice rub down if you need that. But as far as massaging, no, I'm not 100% sure on, you know, the proper massage techniques, but I do know the basics about how to just rub a knot if you have a knot, or keep your legs moving and things of that nature.
Okay. So I'm curious, what is your favorite part of this process of keeping boundaries and making sure people have agency? I'm just curious about your own learning. What has been your just favorite expansion part of being a doula?
I think my favorite part is getting to know the mom. Because like, even like getting to know the mom before baby and then right after baby, and like that postnatal period, because it's so fascinating to see how much people grow in that 9 month to a year process. It's so fascinating because like I meet you and sometimes I'll meet a mom as early as about 6 to 10 weeks. Sometimes I'll meet them closer towards the end where they're like in their 20 something, almost 30 weeks. And it's just very fascinating how much you see them just change because they'll start and say, I have no idea what I'm doing, especially if it's a first time mom. I have no idea what to do. I'm lost. I'm confused. Like, this is a whole baby. Like, what do I do with another person? And it's like, by the time this baby comes, they're like on it. Like, they know exactly what to do. They know exactly how to say it. They know exactly like, and it's just super fascinating because it's like, and I always bring up, like, you see, you thought that you couldn't do this, and now look at you doing it. Like, look at you just out here excelling and being a mom and stuff, being a whole parent. And so it's just good to kind of, I like to be able to remind them where they started and how, you know, they're blossoming and doing a wonderful thing, because being a parent, being a supporter of another human being is a big deal. That's a big thing. Because just supporting a partner is a task and a job. So supporting a whole little person who literally knows nothing about the world, it can be scary and it can be a lot. But it's like I always like, that's the best part for me, is reminding them that you are literally their world right now. So you have to make sure that you're doing what you feel is right and what you feel is just, to make sure that they're right and just, in a sense, into your eyes, you know? So I think that's my favorite part, just being able to see the evolution and the growth and how they transition their baby into a whole new realm of stuff, of the world.
So profound. I imagine, you know, you're growing another human being and then delivering them into this world. It's such a like sacred duty what you're doing, you know. It's really powerful. It's very profound. And then to feel sort of that natural, I know how to do this. I can embody this wisdom and hold this child that just traveled through my body to get here, right? It's a long journey. 9 months is a long journey.
It's a process. And I tell people all the time, I'm glad you said a journey, because I tell people that all the time. It is definitely a journey. From the hormones to the emotions to the bodily changes to the cravings to just everything in your body literally prepares itself without you telling it what to do. So I just feel like it's a mind-blowing thing. Like, it's a mind-blowing process, because it's like your whole organs, like everything moves up so something can grow and make space and all of those things. And like, so I like to say, birthing people are trees. Like, you're growing something from within you, like you're a tree, like you're just, it's rooted in something so beautiful, and stuff falls, like it's something comes right on out, and it's just a beautiful thing. And I always say apples and trees, like, then that's what you're growing. It's like you're growing your own little apple, and it's amazing.
It is amazing. It's funny you talk about apples. I must be hungry, but I wonder, are there nutritional requirements that change that you would help them change? Like if somebody doesn't like a particular food and you think it might be helpful, like if they have a nutritionist or their doctor tells them, you know, maybe to change their diet, is that also something you would help them with as a doula?
That definitely is something I help them with. So we've had moms who, you know, may have an iron deficiency of some sort. So I may say, hey, maybe you need some more kale. Maybe you need some smoothies. Maybe you need spinach, maybe a banana. But I don't like all those things. Or maybe we should blend it up and put it in a smoothie. Or maybe we should, you know, like try different things. I always try and encourage them to do what they like, but do it in a way that is healthy for baby and yourself. So if you know you have this deficiency going on, okay, well, let's look at things that could help this deficiency besides medication. Let's see what kind of foods we can use to get more iron. Let's see what kind of foods we can get to get that blood pressure down if you have a blood pressure problem. Let's see, you know, certain types of diets. And I do check in with moms and birthing people to see what their diet is like, to make sure that they are getting like proper nutrition and things of the sort. So like I'll give them a nutrition plan of, you need this much water a day, this much vegetables, this much fruit, this much this, but it's always a happy compromise. If you don't like this, well, let's try this for that. And it's always about alternatives for me. So if one thing doesn't work, let's try another thing. As long as you're getting that proper nutrition, let's try this. It's all about a happy balance. So that way this baby is getting what they need, but you're also getting what you need, because if the host is not healthy, then how will the baby be healthy?
And I would imagine nutrition too, building good nutrition in the musculature gives you more energy. You have more bioavailable when you end up bringing the child through, that there's much, much greater capacity. Is that right?
Yeah. It's very true. And that's why, like with laboring at home, like you said, you can eat more, you can drink more, which allows you to build up that energy and have more energy for when it's time for you to exert it. Just like your water intake may have to increase because you now have to provide water for yourself and a baby. Because what you eat kind of goes through and gets to that baby through your umbilical cord and like your placenta and those things like that. So it's like everything we kind of eat affects the baby. So it's all about like knowing, okay, you need 7 to 10 grams of like of whole grains. You need 3 to 5 servings of fruit a day, and vegetables a day. You need 3 to 5 servings of like your plant-based fats and oils, things of that nature. And those things can look different, like dairy. They don't say what kinds of dairy. Like it's not that you can't have sugar or sweet stuff. So like if you want ice cream to be one of your sources of dairy, it's still dairy, but it's a happy medium. So if you want, you want ice cream, for instance, for dessert, that's nothing wrong with that. But did you have enough veggies for the day? Did you have enough this for the day? Did you have enough that? Or if you want your ice cream, how about you put some bananas on top? Let's put some strawberries on top. It's all about a happy medium. So I always tell that to my birthing people, like, I don't want you to feel like you have to entirely change your life because you're about to have a baby, but there's always a compromise or an alternative, to what you used to like that you still can have. So it's never about just taking it all away completely. It's just about making some adjustments so that way it works for the both.
Yeah, it sounds like you're keeping a lot of harmony between what's needed and what's wanted. And, we need to have some things that we desire too. I think we can't I don't like going into some kind of stoic environment with a lot of rules, but if I know that I can incorporate other things that might feel more comfortable, if you're saying put kale in a smoothie, that might be more palatable to me because I don't like the bitterness of it. Right. So, or putting it in with nuts or something in a pasta might make it more appealing.
Mm-hmm. Exactly.
Might not normally eat. Yeah. Interesting. And when the birthing woman, the person goes home with the baby, do you visit them after the baby comes and help with like the holding and the nursing and the latching? Okay.
Yes, I do that too. That's why I say I'm more of a full spectrum doula. I can kind of do, I do postpartum, prenatal, postpartum, all that, because it's all important. I help with latching. So I know some basic latching techniques on which ways to put baby, how to do the different arm holds and things like that, how to properly make sure they're latched right. I also I try and make sure that we have, there's something called like PMADs. And so that is all about the perinatal mood and anxiety disorders. So try and make sure that that's understood, so making sure their mood is regulated, making sure that, baby blues only last about 2 weeks. And some people misconstrue baby blues with postpartum depression. But if it's longer than 2 weeks, it may more than likely to be, postpartum as opposed to baby blues. So just making sure that they're being sought for after baby comes as well. Because my philosophy, if you I'm pretty sure you might have heard it. Once that baby comes, it's no longer about the parent. Like once baby is here, it's all about this baby. That's very true. It is. But that baby is definitely getting love. That baby is definitely getting everything that they need. Their baby is definitely being supported. So I always say, look out for that mom. Hold that mom. Be there for that mom because that baby is definitely getting the love, support, and everything that they need. So if you're there for that mom to help hold her up, her baby is definitely getting everything that they need, want, and desire. So if we're not seeing for that mom or that birthing person and their partner, then how are we making sure that baby can be put first? Now, don't get me wrong. I don't just disregard the baby. I'm definitely here for everyone, but I definitely like to make sure that mom is also well, mentally, physically, emotionally, because she is usually that first line of support for the baby, or that partner is the first line of support for that baby. So like, you know, people come over to visit as soon as you have the baby. Oh, let me hold the baby. Let me hold the baby. Okay, well, if you're going to hold the baby, can you maybe like do this chore for me while you're holding the baby? Because, you know, being a first-time parent is hard, you know, especially if you're a breastfed parent. That baby may not want you to put them down, or that baby maybe, you know, you usually feed your baby on command. So if that baby is crying all the time for wanting milk and you're basically the cow for your baby, then guess what? You are not maybe able to do everything that you'd want to do around your home, or you're not able to like cook. So sometimes I'll help them prep meals before they go into labor, freezer meals. Put everything in a Ziploc bag, season your Ziploc bag, close it up, put it in your freezer, put it out, pop it in the stove, pop it in the pot, or pop it in your slow cooker. You have a meal. So stuff like that, that helps them with their postnatal. Making them a list of what needs to be done, putting it on the refrigerator. So when you have somebody come over, like I said, you want to hold my baby? Okay, can you vacuum while you hold my baby? Can you wash dishes while you hold my baby? Can you hold my baby while I do these things? Stuff like that. Or even as far as having like a list of things for people to bring over whenever they come to visit. Like moms usually, or birthing people usually don't go out much once they have that baby until it's time for that visit, because nobody wants to take their new babies out. Like if they don't have to, like before that 6-week period, not very many people, you will see them out with their little bitty baby unless they absolutely have to. So it's like, okay, I need this, this, and this. Can you bring this over when you come? And so I help them to get those things together and create lists and create things that they may need or things they want done to make sure that everything is still being able to run smoothly, while also, you know, being able to have the support and have friends over and have family over, because we don't want to be alone once you have the baby. And I never tell them, you know, block your people out, especially if they want to come and support, but just let them know like, okay, I don't mind you coming to visit, but I may need your help with some things.
Yeah.
And
yeah,
so
I'm curious, do you find in that the moms are open to asking, you know, their friends for help to bring things, to take a nap? Maybe could you come over, maybe Nydia, so I could take a nap for an hour? I'm very tired. I imagine, you know, it's so exhausting. You're creating all this milk, you have a new baby. There's a lot of learning in a new baby too, those first 6 weeks.
Yeah.
I can't imagine what the person's going through. So I'm curious, is that asking for help? Is that like is it a thing?
You know, some people don't like to ask for help. Some people find it very hard. And then we just sit and I let them know about PMADs and about, you know, the time before your pregnancy, the time during your pregnancy, the time after your pregnancy, and I give them education. Now I can't force you to make these lists, and I can't force you to enforce these lists, and I can't force you to ask for help. But I do make them understand that burnout is real. Burnout is very real. And if you can't properly support yourself and get the help that you need, then how are you supposed to properly be able to help your baby? Babies can't talk, so they can't tell you what they need. We can talk, we can communicate what we need. So doing that sooner than later helps the whole system be able to flow. So before we reach that point of burnout, or before we reach that point of feeling like, oh my God, I'm in this alone, let's reach out for help. So I've had some people that didn't want to ask for help. They found it very hard. And I've had some who were like, I will definitely ask for help. They better help me. Like, I need this help.
Yeah.
So it just depends. It just differs. Because I've had aunts who will do it themselves, who will just figure it out, who will just, I don't need to ask for help. I don't want to be a burden to anyone. And then I've had some who are like, here's what I need. This is what I need. I need you to bring this. If you come into my house, do not come empty handed, because my baby needs this. I need this. I couldn't go to the store. I won't leave the house. Like, so it just depends on the person, honestly.
It sounds like you're creating such a good system though, too, like putting things on the fridge and, you know, and teaching that community effort, right? And taking care of this new baby, so the mom then can recover her energy, right, to her rightful owner, while her partner and the partnership can be more harmonious if others in the community are willing to help. It sounds like you're putting some pretty powerful systems there to maintain boundaries and yes, come and see the baby, of course, and know that it's a new baby, and I also might need some support while you're here.
Absolutely. By saying that, I think my grandma used to say, and everybody used to say, it takes a village. I definitely emphasize that all the time. Like it takes a village sometimes, and that village may look different for everybody. That community may look different for everybody, but as long as we have that community, we have some sort of village, it all works.
Yeah, and I'm so grateful to hear too that you're visiting after the baby has come and just kind of noticing someone's, it might be a physiological, hormonal imbalance, or maybe they're not eating enough, that there's someone there watching over the birthing person, because I imagine there's a lot of energy expended and then it has to return in order to care for this brand new baby and stay regulated. That requires this nutrition that you're doing and also these wonderful tasks that people can do. And those are things I think people really like to help. Mm-hmm. And so if I came to visit someone and there were 3 things that I could do while I was there, including giving them maybe a nap or making lunch or something, and then holding the baby while I'm there, I think that would feel really nice and everyone benefits.
So. Like I used to do it for my sister. I have 2 nieces, and I would go over to her house and just hold the baby while she goes and sit in the tub.
Yeah.
Like, when was the last time you got to just sit in the tub? Just worry free. She's like, well, I've been taking showers. Okay, go sit in the tub. Well, I don't need to. I just got a shower. It's okay. Just go sit in the tub. Go in, it's just simple things like that we may not realize that it'll make a big difference. Because, people that may not have kids or have older kids, we take those little things as that's a normal routine for me. Like, I'll go sit in the tub any time of the day, if I don't have to worry about my baby crying or my baby just being whatever it is, because we don't realize that new babies are just a different ball game. So, and I noticed that for her, it was like a woosah when she got out of the tub. She's like, oh, wait, I didn't know I needed to sit in the tub.
Surprise.
Right, surprise. Like, now you feel wonderful. You feel even better because you got to just literally sit in some hot water and let your body fully relax.
It's amazing. All right. Well, Nydia, I know how busy you are, and I'm so grateful for your sharing your time and wisdom with us today. And is there anything that you would like to share with our viewers, or any resources that you want to mention to help people understand the benefits of working with a doula?
I definitely can send you some. I'll have it. I'll send a resource list over to you. I'll email you just some things that I have and some resources that I use and go from. I have a list here, so it'd be probably a lot for me to just name them off. But I have like different organizations for mental health and postpartum planning and things of that nature. So I'll definitely get you that resource list over.
Wonderful. And if anyone wanted to reach out to you, if you care to share your contact information, just to include that if someone has a question for you or something that didn't get fully understood by my line of questions, something got missed somehow, if they want to reach out to you, would that be all right?
Oh, most definitely. I'll put that in the resource list as well. I'm open to questions, open to conversations. I'll put all of that in there for you.
Perfect. Thank you so much. And thank you for the work that you do for our beloved women.
Thank you for having me. I loved it. It was wonderful.
All right, Nydia, take good care.
You as well.